Story this morning is investors are eyeing President Trump's agenda as Republican lawmakers push for repealing and replacing Obamacare and overhauling taxes. Senator Pat Toomey addressed the timeline for health care legislation yesterday on America's Newsroom. Watch.
There are people who aren't quite there yet, but we've got a new version coming out today or tomorrow.
Okay.
And that is meant to bring on board people who still have their reservations. I hope we'll get there.
Joining me right now is House Majority Leader, California Congressman Kevin McCarthy. Congressman, it's always a pleasure to see you. Thanks so much for joining us.
Well, thanks for having me on the show.
So you're releasing an ad called "The Failure of Obamacare" this morning. Why?
Well,
yeah, go ahead.
Well, it's very important that people know the research of what's happening. It was the time that we passed the bill in the House and it's over in the Senate, another co-op has collapsed. So only 4 survived. 19 of the 23, given more than $2 billion in Obamacare, have collapsed. And the facts are just there. We have to pass a new bill.
Yeah, you have to pass a new bill, but you had a bill in the House and the Senate never voted on it. Why?
Well, the Senate's working through it right now. I think at the end of the day, it'll look very much like the House version. And they can get the job done. I know a lot of people are talking about the August recess. The worst thing that can happen in this building is if you give somebody a further deadline, they won't do anything until the deadline happens. Let's get this done in July. Stop worrying about August and make it happen now. We got 3 more weeks. We can get it done.
So you think you can get it done in the next 3 weeks. But let me ask you, Congressman, because people are scratching their heads. You went through the time and the energy in the House. You went back. You did it twice to go back, renegotiate again, to bring it to the floor for a vote. You got the vote. You had the bill. The Senate comes up. It says, oh, we're just going to start again. We're going to do our own bill. Why didn't the Senate just vote on your bill?
Well, like most places, and the House does a version, the Senate does a version. And what's happening in the Senate today looks a lot like what happened in the House. We had an artificial deadline. The leadership picked. We worked towards that, couldn't make that day. We worked on it further. Then we had a week where we had a break. People went back to their districts. They heard from their constituents to get this done. You made this promise. We came back and passed it. That exact same thing is happening in the Senate. Let's look what comes out of the Senate version, and I believe at the end of the day it's going to look a lot like the House version.
Can you tell us why there's so much debate and fighting about the details of this bill? Is it largely about Medicaid? Explain to the audience why Medicaid has become problematic, why it has expanded so much to include people that really shouldn't be there. They're not impoverished, and at this point, you've got a lot of fraud in the system.
Well, remember this, what Medicaid was created for, the blind, the disabled, and the pregnant. And we made a promise to those states, you get what paid with the FMAP, which is roughly 50% state and 50% federal government. Well, when Obamacare came along, they took people who were not blind, disabled, or pregnant, but they were able-bodied individual, up to 138% of poverty, and the federal government said we'd pay 100%, and the very lowest we'd pay 90% of that. Which governor wouldn't want that? But the American public, that will cost you $1 trillion in less than 10 years for 1 year. That's how much we appropriate in an entire year for government. So it is not ability to continue to go forward. We think there's a better way to actually make Medicaid solvent and actually put it into the future. And what's better for individuals is actually to have a health plan that they get to choose, they control. And we have affordability, because what Obamacare did, it doubled the premiums. Remember, premiums were supposed to go down $2,500? And the real secret here that people don't realize is if you don't have health care, you pay a penalty. More people pay the penalty or take the waiver than actually signed up for Obamacare. No one talks about what the CBO score said back then and what reality is today. I think there's a new way of moving forward. To look at affordability, look at the quality, and that's really what our health care bill did, and I expect that to come out of the Senate and us to get this done before the end of July.
All right, so you say you can get this done in the next 3 weeks. How do you see the Senate coming together then? I mean, how do you see, there's a lot of criticism about what's on the table right now because of what's in Medicaid, because of big government, and perhaps not getting the premiums down as much as some would like.
Well, we've got to get the premiums down. You look at the Health and Human Service study, in the individual market, premiums have gone up 107%. You now have 41% of all the counties in America that only have one provider. There are a number of counties in America that will have no health care provider next year. So there is no option. Republicans made this promise. They campaigned on this promise. Now we have to deliver on it. The House has done the job. The Senate has been back last week in their districts, in their states, listening to the American public, and I will guarantee you they are telling them to do what you promised you would do, and we can get this done.
So it sounds like if you don't get this done, if the Congress doesn't get this done in these next 3 weeks, then it's appropriate to lose seats next year then, because you're pretty sure that this is going to get done. It must get done. The thing is imploding as we speak, right?
Maria, there is no option.
But
this is the promise.
So there's no plan B then?
No, we will get this done. If you plan for B, that's where people will go.
Okay.
We promised we could do this. We could find affordable care and quality and have the control of the individuals to pick what they want. We have more control over what we want to pick in our cable companies than we do in our health care. We can make a fundamental difference here and have affordability where premiums are lowered, quality care is better, and the people have the control.
All right. What did you think about Ted Cruz's comments, Congressman? Because he's talking about this August recess. He weighed in yesterday on the upcoming break during Hannity. Listen to what he said. Got to get your reaction.
People who are pushing for that are, I'd say, the folks elected in the last 5-6 years, what I'd call the young Turks, that we have been consistently in the lunches pressing, saying, look, we got a job to do and we got a short window of time, and so we ought to stop taking recesses, stop taking time off, and just keep going until we get it done.
Hey, I think he's talking about you. You were one of those young Turks, right? I mean, you were on the cover of a magazine with your two colleagues there. You were the young Turks, you, Paul Ryan, Eric Cantor. You were going to get things done.
Well,
right?
You know, that's right. And when we were first put on there as young guns, we were sitting in a minority. And after the next election, we defeated 63 Democrat incumbents. And we took the majority in the House, which we never would have won the Senate because a lot of those young guns that came through went over to the Senate. Now the promise is that we would finish the job. The House has done the work. The Senate needs to do the work. Don't start putting a further deadline out into the future. Get it done now. They promised that they would come back, get the scoring done, listen to the senators, and vote on it the week after next. Let's do that, and I'll promise you this. You move it out of the Senate, we'll get it out of the House and send it to the President's desk to be signed, and we could all see that America is on a new path forward, and then we'll move on to tax reform.
And you've spoken to this about your colleagues in the Senate. I mean, if you don't get, if we don't see what you're putting out there, are you going to change your mind? Are you going to say, okay, well, then maybe we will stay in Washington and not go on break in August?
We need to get our work done. But the one thing I know about Washington, if you tell them the new deadline is August, they won't do anything in July. We have 3 more weeks here. Let's not waste them. Let's do it now.
So what are you going to do in the next 3 weeks to get people to come to the table?
Well, in the House, we'll continue to move legislation. We're working on anti-human trafficking this week. We've got a number of bills moving forward. In the Senate, I was just meeting with the senator yesterday that he was one of those on the fence, working with them on the same challenges that we went through in the House, helping them find a path to get back to pass that bill that deals with lowering the premiums and raising the quality. They are close. They are very close to getting it done.
You think they are very close? Well, that's good news. Anyway, how close are you guys on tax reform? I know you've been having meetings and looking at it, but I know that you really can't get anything done until you finish health care here. But is there the kind of debate going on about health care right now that there has been about, about taxes than there has been about health care?
Yeah, so we're taking the lessons from health care, those that we could have done better, and applying them to tax. The one thing that happened with health care, remember, we took this up at the very beginning. We promised the American public. You were watching the collapse of Obamacare. The administration was just coming in. Tom Price wasn't even sworn in when we started up on health care, HHS secretary. So what we're finding now is now the administration has people in place. They're coming down meeting with us. The Senate is meeting with us, and the House is meeting together. So we're working out our differences ahead of time. But let's not look past. We have to get a budget done. And Diane Black has been doing a tremendous job in her committee. We're going to get that budget done this month. Once they finish health, then we'll have the mechanism for reconciliation, because all of this stems because the Senate continues to wait for this 60-vote rule that is not in the Constitution. A lot of these would not be a problem if the Senate simply worked by and used the majority they have to pass the current bills that we have sent over there.
Yeah.
We passed it in the House on a majority. Why don't they pass it in the Senate on the majority? Because we can't do everything they want because of their arcane rules and the Byrd rule. There's so much more we would like to do, but a lot of that hinges on the Senate. So the Senate gets this health care bill done. We'll move right on to tax reform, which is really, if we want to solve so many problems in America, we need growth.
Yeah.
For too long, in the last 8 years, we have not had much growth in this country.
Right.
And just moving that up by 1 or 2% will increase the income to the average American, and actually the number of jobs out there more than 1 million by if you increase it by 1%.
Right, which is why we want to see you get this done, and I know our audience does as well. Now, Congressman, you mentioned human trafficking and this Human Trafficking Act, one of the bills that you're working on this week. Tell us about it.
Well, we got the federal Frederick Douglass reauthorization. There's 3 bills we're moving this week. We've already done 13. Another one is actually training the Labor Department to actually what to look for. More than 20 million people are trafficked every single year across the world. And this isn't happening in other places outside of the United States alone. This is happening at every single district. Jason can tell you about it. Every district across America, this is happening, and is a place that we need to stop it. And we've got an administration that has engaged in this, and engaged in this in a bipartisan way. I've been to a number of meetings down at the White House. Ivanka Trump has really worked diligently on this, bringing a bicameral group together of the senators, Republican and Democrat, and the House, and all the nonprofits out there as well. So we work as one and really stop the individuals who have been trafficked and actually train individuals on how to treat them.
Well, of course, we all agree on that, Congressman. We'll be watching the developments. Thanks so much for joining us this morning.
It's always great to be with you.
Good to see you, sir. Kevin McCarthy there. We'll be right back. Stay with us.